Today I'm angry. I'm angry because I've spoken to the families of aged care residents who've had enough. Richard Colbeck must resign today. If Richard Colbeck does not resign today, the Prime Minister should sack him.
That call coming after the embattled aged care minister finally fronted a Senate hearing. He'd been too busy to attend mid-January, despite finding time to spend 3 days at the 5th Ashes test in Hobart.
You told us that you couldn't attend the hearing on the 14th of January because it would divert government resources from the COVID response. It looks like you just won't come in because you would rather go to the cricket and drink frothies.
I did make a specific decision about the balance of my portfolios, obviously as Minister for Sport as well as Minister for Aged Care Services and Senior Australians. It was a decision that I made. I have to stand by it and live with it.
Colbeck defending both himself and the aged care sector.
I don't accept that it's in complete crisis. My view, and the data actually supports that, is that the sector is performing and has performed exceptionally well in the work that it's doing.
Those in the sector see it differently.
Aged care is absolutely in crisis. We have unprecedented numbers of older people who are dying because of the impact of the Omicron wave of COVID.
More aged care residents died with COVID in January alone than in the whole of 2021. And despite their priority status, around a third of residents still haven't received a booster.
So there's about 35,000 that have not taken it up, and we'll continue to encourage either the residents or their families to take this opportunity.
Hesitancy is an issue, but it's probably a minor part of the issue. Some of the residents simply weren't eligible when the clinics arrived. The second big issue has been needing to obtain consent, and it's been difficult for aged care providers to follow up with families when we've had so many staff off from that mid-December peak of Omicron hitting us.
Federal authorities will establish a task force to find out what went so badly wrong.
We are looking to try to get more details about those deaths. It is not an easy thing.
We would not have needed a task force if they had listened to and learned from the experiences of Newmarch and the early experiences in Victoria.
This is a crisis. In the wake of a Royal Commission that described the aged care sector in one word, neglect.
We did invite the Prime Minister, the Health Minister and the Aged Care Minister to speak to us. They declined. We're joined instead by Shadow Aged Care Minister Clare O'Neill. Clare, it's pretty clear that Labor is not impressed by Richard Colbeck's record. But given how rampant Omicron has proven to be all over the world, what would you have done to prevent the current crisis in aged care?
Well, the big problem here is that aged care was in crisis before COVID even hit. Waleed, we've had almost 9 years now of disgraceful neglect of this sector and the vulnerable people that it protects. Once you've overlaid the pandemic onto the top of that, that's when things have really started to fall apart. We're talking about homes being staffed routinely at unsafe staffing levels, aged care homes without rapid antigen tests, so they actually can't today tell you whether their residents have COVID or not, insufficient PPE, so staff are working when they're not safely protected, and a vaccine program that's been completely bungled from beginning to end. It's just not good enough, and we do need to make a change.
Right, so I understand your criticisms. I'm interested, though, in what the solutions might look like. Now, let's take the booster program, for example. There are a number of obstacles that are not really to do with the government themselves. You know, residents, some of whom aren't eligible when the booster clinics arrived at their specific place. Others were ill or they were unable to be vaccinated for some kind of medical reason on the day of the visit. There have been staffing shortages. We've seen that across many industries now, with people being in isolation, for example. Some have been thrown into lockdown because of the outbreaks in several of our cities. And of course, there is a residual issue of vaccine hesitancy amongst some of the residents. I mean, is there anything that you can think of that you could actually do about those things?
I think you're being a little bit forgiving there, Waleed. I mean, of course, this is challenging. No one said managing a pandemic's easy, but we're in the third year of this thing now. The government's already done a vaccination rollout in aged care, and it simply should have gotten the hang of how we get through to the people that live in aged care that they need to get a booster shot and be able to give it to them.
Sure, but what would you do about it?
Well, I mean, obviously what we need to do is make sure that more people in aged care get vaccinated, and that's going to mean not just thinking that you can go once to an aged care home and that everyone's going to get vaccinated on that occasion. We've got to be much more precise about this. But the other thing that hasn't happened here, Waleed, is there hasn't been clear messaging to aged care residents about why getting a booster shot is so essential. The very tragic truth is that there are preventable deaths occurring in aged care because COVID is hitting those homes before the booster clinics have.
Your party, Clare, has promised to make a submission in favour of a pay rise for aged care workers if you get elected. The Health Services Union wants a 25% increase for some 200,000 workers. Is that what Labor will be supporting?
Thank you for raising that, Lisa, because it is probably actually the crux of the issue in aged care at the moment. We've got these amazing people that work their guts out every day to care for elderly Australians, and they're some of the worst paid people in the Australian economy. So you will literally earn more at a checkout, stacking shelves in a supermarket, working in Bunnings, than you will doing this incredibly complex and emotionally taxing job. We haven't committed to an exact percent, but I will say that I think the demands that the union are making seem fair and reasonable, but we do need to wait for Fair Work to make a decision about what that pay rise is exactly going to look like. But I think we need to do a lot more as a country to support them better.
Claire, thanks so much for your time.
Great to be with you guys. Thanks for having me on.
Well, like you were saying, there really are some logistical difficulties in administering a booster program mid-wave. But curiously, those are not the reasons the government's really pointing to. They've jumped to pointing towards things like hesitancy in people in the facilities and their families, not really backing it up with figures at all. In fact, we're really not really hearing the figures that really matter. Things like how many deaths have there been in people who have not received the booster who were otherwise eligible.
What's the breakdown you mean? Because,
there's a complete dearth of figures there. And it's bizarre that we can, yet again, a consistent theme that we've seen in this pandemic, blame shift to the people who've got infected and gotten sick.